Hey everybody, it's Dr. Potvin. Thank you very much for coming to episode 2 of Wellness Ed Sunday. For those of you that are tuning in for the first time, actually hold on a second, I'm going to put on. Sound would probably be good, eh? So again, thank you everyone for coming to the second episode of Wellness Ed Sunday. For those of you that are coming in for the first time, this is a venue that I would like to use to help set people up for their week, provide health tips that they can integrate into their, I'm sure, busy lives, but also to look at some of the things that people have a harder time talking about in healthcare. We're going to look at people's stories, we're going to hear their questions, and we're going to unpack them together. And my hope is that as an educator, I oftentimes see that whenever a student has a question and they raise their hand and they ask it, usually everybody else in the classroom has the same question. So it helps everyone out. And so the whole point of Wellness Ed Sunday, outside of preparing you for your week, is to be a place where all those questions that maybe people are a little scared of asking, that we ask those questions, and there will be hundreds of people out there that were wondering the same thing. So let's get started with the letter of the week. And it starts like this. Dear Dr. Potvin, I have a really stressful job. Tasks have been inadvertently dumped on me over the last 4 or so years, and in an attempt to prove myself, I often put myself last. My health, as you can expect, has been slowly declining since this began. It certainly hasn't gone unnoticed by me, as I've actually had to go into the hospital a few times with chest pain, which apparently were panic attacks, and my weight has climbed significantly, especially in the last year. Well, my doctor has noticed too, and she isn't happy about it. My blood pressure has also been creeping up over the last year, and I've been experiencing significant low back pain. With the few health scares I've had, each time she told me if I would just lose weight, it would fix everything. I'm supposed to go in for my physical next month, and I know that I've gained since last year, and I'm terrified of the visit. It always goes the same way. She runs a bunch of tests, tells me I'm fat and I need to lose weight, and then that's it. The urgent care docs know me now and say the same thing. I know what they all think when they look at me. I just leave feeling dismissed and defeated. I feel so desperate and scared when I have a panic attack, but the thought of going in and being yelled at is enough to make me stay home. How can I feel less scared of getting the care I know I need? Signed, petrified of my primary. Well, firstly, I want to say thank you for writing such a brave letter. I wish that this was a less common occurrence in medicine today. What you're experiencing is actually what we call weight bias. It's essentially an extension of weight stigma that individuals experience out in the world, which is unfortunately still a socially acceptable form of discrimination, at least here in the U.S. And, unfortunately, weight discrimination or weight bias has actually been shown to increase risk for depression, anxiety, and suicidal ideation. And in studies, when we actually control for other conditions that can cause weight gain, we find that when people experience weight bias, it ironically increases their blood pressure, circulating cortisol, and inflammatory markers, so chemicals that our body create that actually cause chronic inflammation in our tissues. Now, we also know that when weight bias is present, doctors will keep visits shorter, and they'll run labs in lieu of doing, a more complete physical exam or case history. What's more, the studies have shown that weight bias in healthcare can actually cause people to gain weight. Meaning, even if the conscious intentions of your physician are to help, which, they likely are, her reaction to your changing body could actually have the opposite effect of what she wants. And, the truth is that weight gain and loss is complicated. You've already identified what contributed to it for you. So simply telling somebody that they need to lose weight isn't helpful, usually ever. And it's not surprising to me that your provider's recommendations made you feel really dismissed, and made the situation more stressful to you. Now, when I was in medical school, I wrote a research paper on the occurrence of weight bias in primary care. And at that time, there were only maybe one, possibly two really prevalent researchers studying this topic. And there was little to no resources for patients or for doctors on how to combat this type of bias. And I'm happy to tell you that this isn't the case anymore. We still have a very long way to go. But it was, I will say, after I, went through the letter and started looking up some resources, it was heartening to me to see that there's now actually a discussion around this, so less people will have to, to suffer, as I know that you're suffering right now, petrified. So I'm hoping that some of the resources that I share with you today can help you feel strong as you advocate for yourself, and as you move forward in your quest for compassionate healthcare. So I'll be providing a lot of the links for the things that we've, that we discuss below after I've wrapped up the feed. Now, one thing that we often forget about as patients is that we can actually advocate for ourselves within our visits. And I know that's not an easy thing to do, especially when visits are short. And you may not have a fully established relationship with your doctor. But you can actually tell your doctor whether or not you would prefer to discuss, your weight only at certain intervals, or whether you're comfortable actually discussing your weight with them at all. Your doctor obviously holds expertise in health, but you can still determine the foundation of the discussion that you have in your visits. Now, it sounds to me like you want support with stress management, and if weight management is part of that and is part of your goal, you may have to ask for more specific feedback on how to achieve that from them, or request a referral to someone that can help. I find that focusing the conversation can actually be a lot more fruitful for both of you. Now, if discussing weight with your doctor is with them directly is anxiety inducing, which it can be for a lot of people, but it's something that you want to do, I'm actually going to provide a link of icebreaker. It's an icebreaker document that actually can help facilitate that conversation, and I actually recommend a lot of people will give it to their primary care provider or provide it to the office as an educational tool. She may not necessarily be aware of how her take on your case is impacting you, and a frank discussion may actually be warranted. And, I'm not so foolish as to believe that this will fix everything, but it's an option if you're actually comfortable. Now, you may also need to start interviewing new doctors if you aren't comfortable with continuing with this one. And I recognize that changing primary is really complicated by insurance coverage and all of that stuff. But given the significance of your symptoms, I urge you to immediately broaden your health team. And you can do this by including other members specifically for stress management and or weight loss if you'd like. And it may be that this doctor just isn't a good fit for you, or at least not a fit to help you with those specific issues. They may just be there to help you with your, with your annual physicals and your annual screenings. But I will say that, a more holistic healthcare provider, that holistic health field is not necessarily impervious to weight bias. So interviewing your providers is always a really good idea. And I think a lot of people don't realize they can actually do this. you can ask them specifically what tools they would use to help you manage stress or possibly lose weight. And if they don't know, or they hand you a food pyramid and are done with that, or if they put you on 20 pills with no conversation and no education, they're probably not for you. So definitely look in the comments below, because I'll be providing some of the links and tools to help you with that. And I know that you're feeling powerless right now, but there definitely are people out there that can help you with your most pressing issues. And while I have this opportunity, I actually want to make a direct statement to my fellow healthcare providers out there, and that is this. When we're not conscious of, or we willfully allow weight bias in our practices, we're actually subjecting our patients to the same type of discrimination that they experience out in the world, outside of our offices. And this often has one outcome. They avoid seeking care until they're too sick to take care of themselves, or they avoid care altogether. So please let us, refrain from, or I guess retrain ourselves to be more conscious, so that we don't, inadvertently deprive our patients of care, and to most closely follow the first line of our oath, which is first do no harm. Certainly, we can't all be experts in, weight loss and individualizing weight loss plans, but I think that it's definitely, if we're specializing in other things and providing specialized care in other realms, it is still up to us to be able to refer appropriately. And it's not just to pick from a list, but to actually build professional relationships with people, especially, in the US, where things like anxiety and weight gain are super common for a large percentage of the population. So that's, a note out to my fellow healthcare providers. But I want to thank you again, Petrified, for putting a spotlight on this topic. And I hope that the resources that I post below for you give you a leg up on either having that tough conversation with your provider, or, what might be easier and would give you a more well-rounded approach is actually expanding your circle of healthcare providers to suit your immediate needs. And, I know that Petrified is not alone in this type of process, or certainly not in this situation. And some of you may be feeling a little bit stressed, thinking about going back to work after the long weekend, which thankfully is not tomorrow for a lot of people. So I would actually like to teach you a little stress management tool. It's one of my favorites, actually. And I find that it can be helpful for some people when they do it as, if they are acutely anxious, it can be helpful. But I find that it can be even more effective if you actually do it more consistently. You make it a practice. And it's great because it's really simple and it's easy to remember. All you have to remember are the numbers 4, 7, and 8. So 3 numbers. And it's a breathing exercise. So what you're going to do is actually inhale on a count of 4 seconds. Hold your breath for a count of 7 seconds. And then you exhale on a count of 8. So you're going to be exhaling twice as long as it took to inhale. And you can do this as many times as you like. And what I really enjoy about it is that you're not having to block any nostrils. You're not having to twist yourself into a yoga pretzel. All you have to do is remember the numbers 4, 7, and 8. And it can be done anytime, anywhere, with anyone. And half the time they won't know you're doing it. So it can be a really helpful tool when you're in acute stress situations, or just when you're deciding to practice stress management. And I'll actually post a video with instructions if you want to look at them later below this video here. So thank you for joining me tonight. I'm glad that we were able to address one more question that I know is actually something that comes up for a fair number of my patients. And if you have any questions that you'd like to submit, you're more than welcome to follow the link that's directed to my blog in the comments section below. And you can send that to me in a number of ways. By email, through Facebook, or you can send it snail mail. I'll take that as well. And if you want to get updates on any of the talks that I'm going to be giving over the course of the fall, I have a lot of events coming up, especially in September and October. So if you want to come to any of those events, you can sign up for my email list on my website. I'll provide a link for that below. And you'll get updates on when to attend those. And thanks again for coming out tonight. And I will be, again, 8 p.m. Eastern Standard Time. The next Wellness Said Sunday will be happening next week, same time. So thank you, and I hope you all have a wonderful week.